While we were away, we raised 3 children, and I went back to school and got my master's degree in public health. I've worked in both federal government, local government, state government, and city government. So it's kind of a nice, coming to Pelham was a nice step back for me, actually, to have a little smaller area to concentrate on. I was pretty active I was the deputy health director when H1N1 hit in Indianapolis, and we lived in Bloomington in Indiana for about 15 years. So I got firsthand experience about these outbreaks and setting up point of distribution for vaccinations and things like that. So when we moved back here, we finally got an opportunity to move home. We found Pelham, and honestly, the reason we moved to Pelham was the school. I had a son I still have a son, but he excelled, and we needed a school that could actually challenge him with college courses. So it was awesome. He graduated with a semester of college courses done, and he just graduated virtually this month from UConn, University of Connecticut, with a biomedical engineering degree. So I worked in the corporate world while I've been here as a health inspector for the Shaw's Corporation, which entitled me to do a lot of travel. And it got old really quick. So I decided to take a step back and focus on home a little bit. And then when COVID-19 hit, I was concerned. I know New Hampshire is very unique in their health system, their public health system. I'm sure most of you know, because there's no income tax and no sales tax, there's very little money put into public health. Of course, that was before COVID-19 hit. We'll see how that changes now. But previously, there's very few people that let me back up. So the town, because of that, there's only 3 regional offices: Nashua, Manchester, and Concord. They manage the entire state. Public health officers routinely have been building inspectors. I'm working with the chairman of the select board to try and get that changed so that the towns have people with a background in case something like this happens. I've been on the phone in connection with the epidemiologists for the state and the director of public health up there, as well as the director in Nashua. And they are ecstatic that I stepped up and said, hey, what are we doing to the town? I live here. I want to know what's going on. Who's managing this COVID-19 process? And the person doing public health at the time, the public health officer at the time that I inquired, was actually an RN. So that made me feel a little bit better. She had some medical background. However, long story short, I ended up, her term was expiring, and I kind of just was at the right place at the right time. This is what I do. This is what I'm familiar with. I live for statistics and data, and as much help as I can be, I'm willing to be. So that's kind of where we're at. I love living here, and any help or questions you have, like I said, I'm on the phone with them for meetings at least once or twice a week. So I kind of have a little more of the background of what's going on. So if you have any questions, feel free.
Yeah, I mean, I guess, so I'm going to start too, is like, we are starting programs here. I know we had this conversation about programming at the center, and I know there's a lot of concern, in talking to various members about even having programs under the tent. And so maybe, would you be able to speak to the rationale as to why it's okay to have outside programming versus inside programs?
So, as you know, at the beginning of this, when we had the stay-at-home order, it wasn't even recommended to wear masks. We didn't know enough about the virus. What we've learned along the way is the spray is very minute. So when you're outside, it gets airborne a lot easier and can be drifted away. So that's the main rationale behind is as much as you can be outside, be outside. But we also know because it's such a light, such small microns, trying to remember the right word, MMs is what we call it. Because it's so small, it doesn't go any further than 6 feet inside. Outside, it can be carried away. Inside, it drops off at 6 feet. So that's why they ask you to social distance for 6 feet or more.
Okay. Interesting. Very cool. And what about killing it on a surface? I know that's also been very kind of, how much should we be utilizing disinfectants? I mean, I use a spray. I don't know what the stuff is, but I get it from our cleaning company, and you mix it with water. And then we have this, it makes it into this aerosol that sprays. And I've been sanitizing everything. Like how much should we be sanitizing?
So although this is an aggressive virus in the body, when it's outside the body, it's extremely fragile. That we've learned. So household disinfectants, clean it right away. And they're saying twice a day is what you need.
Okay.
Yeah. And, if people are sanitizing their hands often and washing their hands is really the key. They're finding, there you go.
It's my friend.
It doesn't. And I know initially the report that came out of Boston at one of the universities for it living on surfaces. So the state epidemiologist in a call a couple of weeks ago, and the state doctor said the more and more they learn about the virus, the less they worry about getting it from a cardboard box or a surface. The study that was done in a controlled environment where the humidity was controlled. Every aspect of the study was controlled. So it really isn't applicable in real life. It really isn't. You need to still wash your hands, but they're not as worried today as they were in the beginning about that.
Okay, cool. Now, does anybody else have any questions for Karen? Well, we've got her undivided attention here. Have you had questions, Anne?
Yeah, Karen, I questioned Sarah yesterday about the necessity for having your temperature taken when we're going to be outside in the fresh air. I didn't understand why you had to have your temperature taken at that point.
So initially, the guidance was everybody has a temperature taken upon arrival. And the reason for that is a high temperature is a clear signal that you could be COVID positive. And although you're social distancing and doing all the steps, it's one more layer of protection that we give people, knowing that you don't have a symptom.
Okay.
Yeah, that's a good question. I mean, that's been brought up to people have been asking me, because when we had our first program today and I was taking the temperature, like we're outside, and I'm like, I still need to make sure I get in everybody's temperature.
Yeah, because eventually, inevitably someone's going to come within 6 feet. Yeah. And if it makes you feel any better, we're going to open up summer camp on the 22nd, and all 125 kids have to have their temperature checked before they can enter camp.
Okay.
Yeah.
Thank you.
You're welcome.
Any other questions?
I have a question. If nobody's coming in your house, why do you have to disinfect twice a day? Why do you have to disinfect at all if you're the only one in the house?
Do you go outside to get groceries? Do people come in your home to do work or?
Nope, nobody comes in my home. I do go out to get groceries, but this twice a day disinfectant.
I think the twice
even
a day
is, your hands, Yeah,
I think the twice a day is more geared towards where we're going to have
businesses. Yeah.
Yeah, in your own home, honestly, I don't disinfect twice a day unless my kids are coming to visit, or I have somebody else in the house and then they leave, then I disinfect behind them.
Okay. Yeah.
That's really best practice, but you're right. If you're just there and you don't have to, honestly, if I come home from the grocery store, the first thing I do is wash my hands.
Yes, I can see that.
Yeah, and one thing that's a myth I want to really encourage, you'll notice less and less people are wearing gloves at the grocery store, because it's really not effective. No. If you think about them in order for it to be effective, every time they touch something, they'd have to change their gloves.
Right.
Yeah. So
when I get in the car, I disinfect my hands and
you rub it around the steering wheel like everybody.
Right.
We're all going to end up with cracked steering wheels by then.
Right.
Yeah.
What about washing all your groceries, wiping down all your groceries when you're,
No.
You really don't need to do that anymore. They've learned enough about it that if it gets on a surface, it's not surviving very long. It's so fragile. I wish there's some really cool photos that I've seen under the microscope on the effects of just the air and the heat hitting it. I mean, so that's why they're crossing their fingers that the weather is going to help build up some immunity to this, because it gets more and more fragile as we go.
Well,
What
if the
about,
numbers don't go up after all this protesting and all the riots and everything, we'll know that being outside is not so bad. And I hope they don't go up.
Yeah, they, sorry. My daughter with my new grandchild is trying to FaceTime me. Sorry about that.
You can join our conversation.
Yeah, they, oh, so yeah, COVID-19's kind of taken a back seat the last few days,
Yeah,
last 8 days or so. I pray the numbers
I
don't
do
go up.
too.
The reality is they're going to go up. It takes about 2 weeks to see. We're already seeing it in the states that opened earlier. Their numbers are going up.
Really?
Yeah. But we're also testing more too. So people
Yeah.
think, oh, more people are getting it. Not necessarily. Now you can go to a WebMD or not WebMD. What's the place in
Convenient MD.
Convenient MD, and you can get a COVID-19 test, whereas before only certain people could get it.
Mhm.
So yeah.
Janet, Caesar had a question.
Yeah.
Could you give us an overview of COVID-19 in Pelham? Like how many people are known to be infected? How many people have died? How many people have been tested?
Good
What is
question.
the
So in
position
Pelham,
on
we have
testing?
54 positives.
Uh-huh.
how many?
54 positives.
Out of how many tested?
I don't know how many tested in Pelham alone.
Mhm.
54 positives. We currently have 12, which is down 1 from yesterday. We've never deviated any lower than 12. So our numbers haven't changed. Sometimes we get little clusters where, you know, the numbers look like they're going up, but it's all in the same household. We've been very lucky in our town. Hillsborough County is second highest in the state for cases. We are a border town, so that gives other obstacles for us that we really need to address. And so right now, if you look at the map, there's like 3 counties causing all this havoc. Rockingham, Hillsborough, and I can't remember the other one offhand. And it's all southern. And that just makes sense because we're bordering Massachusetts, which has been, you know, the epicenter for quite some time.
I have a question.
Yes.
Out of the 12 in Pelham, how many are hospitalized, or do they just test positive?
So we've had, I want to say 3 to 5 hospitalized. Now, we have had one death I know of, but he contracted COVID while he was in the hospital.
Oh,
Or
Yeah,
something else?
We've had 2 members that have passed away, but they contracted the virus while they were at a facility.
Yeah.
They didn't get the virus.
Right. So often
outside of the town.
when we see the numbers come across, they'll say like Hillsborough County, 10 deaths, 8 of them are in assisted living.
yeah.
It's really kind of turned into a communal living disease at this point for deaths.
Yeah.
It's very sad. So when the vaccination does come out, they're going to give it to them first and seniors. And then the highest hit for positives are the ages 50 to 60. But the highest amount of deaths are seniors over that. So that's the group, those are the 2 groups that will get the vaccine first.
Interesting. Anybody else have a question? Anyone else? Connie, you have a question? You need
Yeah, I have
to
another
unmute her.
question.
Let me unmute her. Hold on. Connie, you need to unmute.
Who's calling?
See if we can unmute Connie.
Okay,
There
can
she
you
is.
hear me?
I can hear you now, yes.
I'm not sure. Oh, okay. There's a lot of information on vitamin D as a precaution. And what is your take on all that?
It's very true, but people should not be running out and grabbing excessive amounts of vitamin D, because anything over 4,000 CUs can be toxic. So people shouldn't be taking more than, the body only needs 4,000 CUs a day. So, and I know a lot of people are out there going, oh, but I can only find 5,000 CUs. No, we want you to have 4,000, no more.
Thank you.
Yes, but it is definitely a positive thing with COVID.
Any other questions for Karen? Anybody else have questions about COVID? Emily?
How about the hospitals for like blood work and doctor's appointments?
You mean like how safe is it?
Yeah.
Well, they are following protocols. So far, we haven't heard of any big outbreaks linked to any of that. They are disinfecting. They're, wearing the PPE so they don't spread it or get it. They are, they're following protocol, and so far so good. They're only letting so many people in. Some people are going to have to stay in their cars. So far so good. So I think you're okay there.
Thank you.
Karen, when do you think they're gonna start allowing like things, non-essential businesses and programs to open, like within, like for say indoor programs or indoor interactions, say like the town halls? Do you think that's gonna be coming in the next few weeks, or what do you think?
Well, the governor extended the stay-at-home order
Mhm.
to the 15th?
Yeah, I think so, yeah.
If he lifts the stay-home order, then I believe pretty much everything will be able to slowly open up. They're also watching these numbers very close. They've staggered out, which in public health, I know a lot of people have been complaining the government doesn't know what they're doing, blah, blah, blah. And what I try to explain to them is when you're trained in public health, there are certain protocols that you take and steps you take when there's a pandemic or an epidemic out there. And you have to be patient. Each one takes time. And over the weeks of the first phase, you look at the data, and then you go to the next phase and you look at the data. The data doesn't lie. The numbers don't lie. So they're watching very closely. The governor does not make a move without looking at the data every day. And if the numbers continue to go down percentage-wise, then, he'll open more and more up. If he can keep this, if he can stay with the 15th stay-at-home order being lifted, you'll see a lot more opening up, because between that time and the time that he's phased in doing more, we will have seen the numbers. So again, we're also doing more testing. So it's kind of a, I get a lot of questions. People say, should I go get tested? Should I go get tested? If you've been exposed or you have a reason to believe either you're sick, you're symptomatic, or you've been exposed to someone, absolutely you should be tested. Other than that, it's really just a snapshot in time. If you just go get tested and they say, no, you don't have it, today you don't have it.
Right.
But next week you may have it. So it's totally a personal choice. But yeah, you should definitely go if you have symptoms.
What about the antibody tests? I've heard kind of a mixed, do you know anything about that?
Yeah, I've had it. I had the antibody test done and I came up negative for antibodies. It is only about, at the first round was only about 50%. It's getting better. They're working on it. It's getting better and better. The only reason I did it wasn't to just find out if I had COVID. I did it because I was in Washington, D.C. when my daughter had her baby and came home the week after COVID really hit. So I wanted to see if I actually had it. But really the main reason is people that are positive can donate plasma, and they're injecting the antibodies into sick people in the hospital. So I have a universal blood type. I could have donated a ton and helped people that are in the hospital. That's the main reason I got tested. but I came up negative, which is a good thing, but.
So if you wanted to get an antibody test, or if you were interested to see, a reason I'm asking actually is, so my daughter, it was in Philly, back in school. She got very sick the second week in February with fevers. She was sick for 2 weeks, on and off fever, then a real high fever, some shortness of breath. They thought she had strep. They did a strep test, came back negative. The doctor's like, oh, it was some weird strain of strep, probably strep. But now I'm wondering, maybe she could have had COVID.
So she could probably talk to her doctor, and they might go ahead and write for her to have one. The problem is we don't know how long the antibodies are staying in the bodies. So what I do know is the first round of human testing for the vaccine was 10,000 people.
Mm-hmm.
Every one of them showed 98% or 99% antibodies. But we don't know if that's going to last seasonally, or it's going to be like a flu shot every year you need to get the vaccination. We don't know. Yeah. So your daughter could get tested. She could have had it, but she could come back negative.
Okay.
See what I'm saying? Because we just don't know yet. I will tell you the vaccine has now moved on to the last trial it needs to go through for approval.
Okay.
To give you any indication, no vaccine has ever been approved within 4 years of trial. And this one could be available in the fall.
Wow.
So, but the next level of vaccinations is 30,000 people. Now, a lot of people in the United States have already had COVID. So there might be a little bit of a struggle to find people currently with COVID. They'll have to go a widespread sample. But if that works, they're looking at rolling it out in the fall.
Wow.
So that's a positive.
Mm-hmm.
Mm-hmm. Good.
That's really good. Do you think, I mean, you may not have any idea, but I'm just wondering, how hard is these kind of vaccines to manufacture? Or is that something that they're already because I've heard like people saying, oh, they're already starting to ramp up. As soon as they get them in trial, they're starting to ramp up production.
So they do two different types. The base of an average vaccine is egg yolk. So when we go to give vaccine, we ask, like with H1N1, we ask if anybody has an egg allergy, and then they have to take the synthetic type. So they can start producing it right away and then adjust it as they need.
Okay, cool.
Great.
No, that's good.
That's good
really
news.
Good. It would be really
it really is good news.
If we could get people vaccinated with something that would give them some level of protection, that would be awesome, especially as flu season. Now, would that be in addition to a flu vaccine, correct?
Yes.
So they're going to have a flu vaccine and the COVID.
And a COVID, yeah. Just like when we had H1N1, it's a different strain. COVID, there's many different strains. There's COVID-2, COVID-4, it's like the bird flu. And this is a different strain called COVID-19. So there's never been any treatment for it. But yes, you'd get both vaccines.
Okay, cool.
I have a question.
Excuse me, can I ask a question?
Hold on, Ian.
What
Hold
about
on,
the
Ian.
different?
Go ahead, Carol.
Oh, thank you. What about the different waves that are forecast?
Different waves.
Like waves, like are they anticipating another wave, like a big
surge?
Wave 1, wave 2, that they're calling it.
So that's what we're watching for now. As we open up our states, we're waiting to see if there's going to be another wave of this virus breaking through, where we have to go back to original restrictions. That's what they're referring to. And then also, like the flu comes around every season, there could be a seasonal COVID-19. I think that's more what you're talking about. Hopefully by then,
Thanks.
I mean, like I said, every day we learn more and more and more about this. There are people all over the world studying this every single day, and the information sharing has been brilliant. I've never been so impressed with country to country sharing, with colleges to colleges, colleagues and hospitals, and the information has been so incredible. I wish people that are frustrated with having to wear the masks and things like that. Trust me, I'm there with you. I mean, I always say going to the grocery store and wearing a mask is awful. When you get out of that grocery store and take it off, it's like going home and taking your bra off. I mean, it's annoying. But I wish those people would see the advances that are being made in record time. Like, this is unprecedented of what's going on. It's really cool.
Good.
Anne, did you have a question?
Yes, even if the governor lifts the stay-at-home order in a couple of weeks, we will still continue with all of these safety measures, right? Until you say it's
yes,
clear.
it's one more step that he's going to lift the stay-at-home order. Honestly, not many people are staying home now.
No.
Anyway, so I don't think things will change very much. But again, it's one more step to see if we have a large jump in our numbers.
Right.
And then he might ease up on that. And then, you know, I know a lot of athletics and sports and contact sports are coming up, and people want to be able to have that. But we have to learn more about it. We can't, you know, there's still too many restrictions right now to say, oh, okay, we're lifting everything.
Yeah, I think I saw something in the news today that Massachusetts just discharged their last kind of patient from their overflow facility or something.
Yep, and they're closing that hospital. Yeah,
That's
that was
good.
fantastic for them.
Yeah, Massachusetts has been hit incredibly hard. You know, like you said, those population centers get overwhelmed because people are living so close together, so tight quarters, housing situations, as well as like just facility, apartment complex, condos, their apartment buildings work buildings with all those people in the elevators. That in and of itself, I think, would be a huge challenge and an undertaking to try to keep people from spreading those viruses, like if you worked at the John Hancock Tower or something like that.
Right, and a lot of people ask the question, well, why aren't we opening? Why aren't we doing this? Why aren't we doing that? If you watch how the virus has spread across the state, Maine and New Hampshire and Vermont were very late to the party. We were some of the last states to get it. So we peaked later, where our restrictions are lasting a little longer, but we also don't have the amount of cases that a lot of the others do. So, I mean, we have double what Maine has, and Maine does not have very many.
No.
But they're still at risk in some areas like we are in the South.
Yeah. Well, they're very good. Any other questions for Karen? Is Connie? Connie does. All right, let's see if we can get Connie off mute. Hold on, Connie, you're muted. See, can you unmute yourself, Connie?
Okay.
There you go.
I was wondering, they keep saying with all the protests that the people are too close and it will have an effect. How long would it take before there's any information on that? How, you know?
So it takes 3 to 5 days from exposure to be symptomatic.
Okay, so.
And you can be up to 12 days. In rare cases, they have seen people aren't symptomatic up to 12 days, but the average is 3 to 5 days. Now, unfortunately, some of those are either asymptomatic, they have it and they don't have any symptoms, which a large portion of people have had, we've discovered. 80% of all the people that have had it have recovered at home, like having a small case of the flu. 80%. So it take probably a couple weeks, we'll see a surge if we're going to see one.
Yeah.
So the average, every time we change something, they say, let's wait a couple weeks and see.
Okay.
If you extrapolate the number of deaths from nursing homes, if you take that out of the equation of COVID deaths, only 2% of the people die from COVID-19.
Oh, okay. But then also they say, I have diabetes, and one of the articles said that if you get it, you're 90% chance of dying.
Well, there are certain conditions that definitely make you more susceptible to the more severe symptoms. There are medications they're using on people that were in that 90% that are working in the hospital.
Okay.
But you are considered a very vulnerable population. Anybody with any kind of autoimmune deficiency, so there's autoimmune deficiency, diabetes, which, and then age, those are the three most vulnerable people. And if you fall in that group, like my mother-in-law does, we've been driving back and forth to Vermont to bring them groceries so they won't leave the house because she's had a liver transplant, she has diabetes. So we tell her you're in the house. So she hasn't left her house since this started.
Okay. Well,
Actually,
thank
she
you.
did once against my orders. She's like, but I had a mask. But nobody else around you had a mask.
Thank
So
you.
yes, I mean, you are at risk for having the most severe, it doesn't mean you're going to die, but you know, you end up in the hospital.
Yeah, thank you.
You're welcome.
Now, so I live in Nashua, I work in Pelham, live in Nashua. And in Nashua, we have a requirement, there's an ordinance that if you're out to wear a mask.
So does Salem.
Oh, Salem has it now?
Yep.
Yeah, I know because there's much higher numbers of active COVID in those communities. Do you see Pelham looking at anything like that, or are they pretty much comfortable with where things are at?
We're pretty comfortable where things are at. People, for the most part, are behaving themselves in Pelham. In Nashua and Salem, you have much more communal living.
Mm-hmm.
And that's where it's being hit the hardest. They have the most cases of each of their counties. So there's a reason that they did that. Pelham, I'm telling you, people have been really, really good. I think they're grateful. I mean, not to toot my own horn, but most towns don't have someone with public health experience to turn to. They have to just keep calling the state or trying to call the regional office. So I think it's really helped that I've even handed out my cell phone number to everybody in the community. You know, call me, let me know if you have questions. And, you know, the people they are letting me know that are positive, I'm in constant traceback conversation with them. I'm sending them documents about quarantine and how to keep them safe and their household members safe. So I think because everybody's been willing to protect themselves and wear the mask to protect others, we've been really successful.
Yeah, I mean, I have definitely noticed Pelham is good when I've gone out to like to pick up a sandwich or to go to Hannaford's. You know, you see people wearing masks and they're very respectful of distancing as well. Like people are really good about keeping distance. You know, and I've been in other communities. So in Nashua, of course, when I go shopping now, everybody wears a mask. So it's nice. You go into Market Basket, you don't have, because it's hard to keep social distancing when you're trying to pass somebody with your cart.
Hey, I don't know about any of you, but the one thing I can't wait to go away are the darn arrows in the aisles. Because if you go the wrong direction, you get the look of death. And I'm like, oh, sorry.
Yeah.
That's the one I can't wait for.
That is just, yeah. And you turn, you go in, you're like, oh no,
Oh, I gotta go down the next aisle. Right.
Yeah, definitely.
I know somebody that backed down the aisle.
There we go. They just don't want that face-to-face contact coming at you.
Yeah. Well, you know, it's so funny. My husband will like go along the edges of the aisles and he'll be like, run up and get that. It's right there. I feel so bad. I'm like, oh, I'm gonna get it. Like,
I know, sometimes you just have to. Like if you're in a hurry,
Right.
like, I walk down the aisle the wrong way and I'm like, I'm sorry. I know I'm doing it the wrong way, but I am wearing a mask. I need this. I gotta go.
I am the aisle police.
Well, you know, honestly, you know, when you're in Market Basket and there's always somebody stocking the shelves, well, they don't do that anymore because it's too many people. It's great. I'm like, oh, I can go up and down the aisle and not bump into some poor stocking kid that's packing.
For the most part, because they've had some positive cases with employees, they are stocking in the morning and disinfecting in the morning and in the evening. So that's why they cut their hours a little.
Okay, gotcha. Yeah. Well, it makes it a lot less crowded in the aisles. And it's just with having less people in the store, it's actually pleasurable to go.
Like I said, people are really stepping up. There's only one or two people that I've gotten pushback from yelling about constitutional rights. But you know what? It's your right whether you want to wear a mask or not, but it's everybody else's right to stay healthy. So you need to wear the mask because it's not really, I mean, it might be protecting you a little bit, but it's mostly protecting people around you. So you'll see things starting to open up. Like I said, summer camp's going to open. We're trying to organize something on the green with the 5th graders to sign their memory books in small groups of 10. And so you'll see things starting to kind of show their bleary eye a little bit, but I'm watching the numbers close. Right now, the town hall is still closed until the stay-at-home order is lifted. I'm working with this new superintendent coming into Pelham. It doesn't look like they're going to have kids in the school in the fall. It looks like it's probably going to be online learning again.
Oh, no.
I'm actually going to be having him, his name is Chip.
No, I don't, I had it written down.
He's actually going to be coming to our coffee hour next week.
Yeah.
Next Monday.
So that's what it's kind of predicted that it's going to be. If the vaccine comes out in August, it might change. But so yeah, I'm working with him. We're talking about, contact sports and how we can arrange to have that start up. It's going to be tough. We'll see.
Wow. Yeah, I mean, I wouldn't want to have to be dealing with those conversations, and I know how difficult it would be for the kids. I'm having a college student who's home. Doing online learning is hard.
It's really hard.
Yeah.
And the kids need some interaction. I will tell you, when the vaccine does come out, I'm on the team with Nashua. They have, I don't know how many point of distribution kits, and we will be they'll be distributed them into communities. And when we get the vaccine, you'll be notified of where and when you can come and get your vaccine at.
Is there any way to do set up a clinic for seniors at the senior center? Would that be something that you would be interested in?
It will. It'll depend. Yeah, absolutely. It will depend on the amount of vaccines that we get. When we did H1N1 in Indiana, the first vaccine rollout, Indianapolis got 300 doses and advertised to the entire public they had vaccine. So they had 2,000 people line up, very angry when they didn't get their vaccine. So my boss and I in our community said, we're not going to get into that. And so when we get vaccine, we distribute it to the local physicians and had them vaccinate their own patients for free.
Yeah.
So they could go to their doctor and get it. So I'm not sure that's going to work here. Nashua currently would like to roll out clinics in our community. So yes, that is very big possibility that we could do some vaccinations I think it'll go to the senior centers first.
Okay.
And
I could easily do a sign up, like have people register.
Yeah.
Basically register for an appointment. So we would know exactly, how many people and how many doses we have. So we don't have like 500 people showing up for 200 doses.
Exactly. And there will be volunteers that will be having them fill out questionnaires. There'll be public health nurse that, we have it down to a science, but you'll be notified as soon as we know.
Okay, cool. Oh, that will make me a very happy senior center director.
And all the members.
And all my members.
That's a touchdown.
Yeah. It's like, what is that? Happy wife, happy life. I'm like, happy senior, happy life. That's the motto.
Healthy senior, happy life is what
Healthy.
I say.
There you go.
Healthy, happy. Yeah.
Healthy, happy senior.
Well, thank you. Any other questions before Irene has some?
I just have a quick question. I know it's not about the seniors. It's about they're opening up the kids' camp, but yet they're gonna do online learning in the fall. I don't understand that. Like, how are they gonna keep them 6 feet apart? Because kids, they're
so children so far, there's only been 200 kids in the state that have even gotten this out of the entire state. So the children aren't getting it. There have been no deaths. What they're trying to protect are the 400, 500, 600 teachers. Children don't get it, but they are carriers.
True.
So we're trying to protect the adults that are in those buildings, really, is the main reason. The kids camp, the counselors, most of them are in the age group that have not been getting it. There's been a few, but very few. They also are temperature checked and masked through the entire process.
So
Again,
counselors are going to be wearing masks, but the kids aren't?
yeah, the kids don't need to because they're,
Doesn't make sense.
I know,
Hmm.
but they're
I would agree with
outside.
that.
The way we're doing it is they're outside. We're building another pavilion so that we can have only groups of 10. Believe it or not, there's only going to be no
Oh,
more
wow.
than 10 kids in a group. We're taking a lot of extreme measures, but that's what we have to do. That's what the governor's saying we have to do if we want to hold the camp. We need to hold this camp for parents that need childcare. And the kids, I feel, are in no danger. With one caveat, and I will be watching this closely. So I don't know if you've heard about, so
Did.
kids aren't getting COVID-19, but there have been this syndrome called
Multi-system organ disease.
And there has been one positive case in New Hampshire, and it is in Hillsborough County. But it's not in Pelham, I will tell you that. We have closed the summer camp to any outside residents outside of Pelham. There will be no Massachusetts kids like there usually are. We are watching it so far. There's only been one. The child was hospitalized and he's doing well, or she. I don't know if it's female or male. I'm keeping a close eye on that because children get that by being next to or associated with people that have tested positive for COVID or that currently have active COVID, not someone who's recovered, if that makes sense.
Mm.
Is that the children with the rash?
Yes, it's an inflammatory and it's multi-system. It's pretty severe. 100% hospitalization because it's inflammatory for every system, multiple systems in your body. So it shows its bleary eyes somehow, some way. It will figure a way.
Do the children that get that are they, I thought I heard are they testing positive for the antibodies, but then it gets activated by coming in contact with it? Okay,
Yes.
Got it.
Yes. So again, that's so new. We're still learning so much about it, but it's a syndrome. It looks a lot like Kawasaki disease, if anybody's ever seen a child with that.
Yeah, I have.
Bright red, yeah. So that's kind of where we're at. We are taking many precautions. The governor has allowed it to happen based on the data we know how the children are reacting to COVID. So we'll see how it goes. Anything spikes or numbers go up in Pelham, we're shutting day camp down.
Okay.
All right, any other questions while we still have Karen?
Thank you.
I think we're good. I mean, I found this to be very interesting, very helpful. I want to thank you, Karen, for coming on today and talking with us and giving us all this great information. It's been, the town of Pelham is very lucky to have Karen here and working. And I personally want to thank you so much because you have been tremendous resource for me as a senior center director and giving me ideas and ways to keep our seniors safe, but yet still be able to provide programs and services. I really appreciate the ability that I have to access you. So thank you again. And
You're
thank
very
you
welcome.
for being here. Yes, Janet? Yeah.
I wanted to say the same thing. I've never met Karen or dealt with you at all, but I feel like I'm in better hands now that there is somebody
Thank
looking
you.
out for us and willing to communicate with us. And that's part of the problem, I think. You know, we get the numbers, we get this or that from the news, but we need somebody to communicate with you and say, we're going to try this. If it doesn't work, this is what we're going to do. If it does work, fantastic. So thank you.
Matter of fact, you're welcome. And matter of fact, when you say communicate, I'm in the process of working with the IT guy for the town. Currently, to reach me, you have to fill out a form, and I want to change that. I want a direct email. And that way, yeah, people can immediately have access to emailing me, and I can answer questions much quicker. It's a better, more efficient system to do it that way.
True.
Thank you.
You're welcome.
Yeah, and it's great too. Like I think what Janet said is right head spot on. And I think too, that folks feel like if they have somebody that they can ask these quick questions to, they can get their answers by somebody who really understands it. I mean, I've had, like I said, numbers of people ask me different things, and I'm like, well, I'm a senior center director. I'm, social worker. I don't know. I'm just doing what I'm told.
When this is all over, everybody's going to have a background in public health.
I'll leave that for you, Karen. We'll just keep referring it to you. So it may be, in a couple of weeks, well, not a couple of weeks, but maybe in a month or so, maybe in the beginning of July after the 4th, maybe we can have you come back on if you're available to kind of give us another update as to where we're at and where we're going and maybe things you're hearing out in the public health world for fall expectations, if you're still on target and that kind of stuff.
Absolutely.
That would be great. Awesome. Well, thank you so much.
You're very welcome.
Thank
Thank
you.
you, Karen.
Thank you.
Thanks.
Yeah, and so just so everybody knows, as long as people don't mind, I have been recording this session just because I think it's really good information. My plan is to kind of email it out to our members as long as you all don't mind. If anybody objects, I won't send it out, but I do think this is such really good information. I think it would be helpful for people to have it. So is there anybody that would mind if I emailed this link out?
No,
All right. Well, then
it was very informative.
Yeah,
very
again, I appreciate Karen coming on. I appreciate you guys coming this morning and meeting with us and asking these really good questions and having this dialogue, because it is important to get that sense of comfort as to how we go about expanding and moving on with our lives and going forward, because it is a new normal. We're not going to go back. We need to keep moving forward, and how do we do that safely? So thank you all for being part of this. I hope you all have a great day. So I think we're pretty much done with our coffee hour this morning, but it was good. And so next week, the superintendent's going to be here. So the new superintendent, be interested to have him come out and talk a little bit about what his thoughts and plans are, especially coming into the town with this virus going on. So we'll see you all hopefully next Tuesday.
Okay,
take care.
thank you.
Yeah, have a great day.
Thank you.
Yeah.
Thank you, Sarah and Karen.
Thank you.
Thank you.